Anxiety surrounding COVID-19 has led to some people avoiding hospitals while putting their health concerns on hold. Fox 55's Jeremy Masukovich tells us why this has resulted in a decrease in emergency room patients, but an increase in severe symptoms.
You're just as safe going to the emergency department or the hospital today as you would be going to the grocery store.
Healthcare providers with Parkview Health say emergency room visits have declined 50% since the start of the COVID-19 pandemic.
And what that has led to is that's led to people that have stroke-like symptoms or strokes that are not presenting for maybe 3 days or 4 days, or patients that have chest pain that hold off for days or hours beyond the time that they need to come to the hospital.
Dr. Thomas Gutwein says by putting off health concerns, patients are making themselves vulnerable to long-term health issues. And by the time they do arrive in the ER, their symptoms are severe.
My message to them would be that if you have shortness of breath, whether it be chest pain, and you put those symptoms off, you're just going to delay the appropriate care that you need. You may cause irreversible damage.
Parkview says the decrease in ER patients has not led to any cuts in staff. Gutwein says they moved ER personnel to help with COVID-19 patients.
Because of COVID-19, because we have to put on more protective gear, we've actually added staff into areas that we never added staff before.
For instance, staff members from surgery or other departments not seeing as much action have transitioned into spotter roles.
There's a high-risk time of being contaminated when you're taking your contaminated gear off, your gowns and gloves and those types of things. So having a spotter actually helps quite a bit.
Parkview is screening each person who comes into a care facility and providing masks once they are inside. They're also placing patients in single rooms and doing extra cleaning.
If you worry about coming to the hospital or worry about coming to the ER to catch COVID-19, that's not going to be a thing. We are 100% safe with keeping people from each other.
In Fort Wayne, Jeremy Masukovich, Fox 55 News.
We reached out to several other Northeast Indiana healthcare providers, but were unable to determine if they were seeing a similar trend in emergency room patients.